Climate change has serious impacts on the safety and health of billions of workers worldwide. Workers are often the first to be exposed to the effects of climate change for longer periods and at greater intensities. Excessive heat, solar UV radiation, air pollution, extreme weather events, vector-borne diseases, and agrochemicals are just some of the hazards exacerbated by climate change that workers face. According to the latest estimates, every year over 2.4 billion workers are exposed to excessive heat at work, and around 1.6 billion workers to solar UV radiation. Air pollution is also a concern for billions of workers, particularly those that work outside. Hundreds of thousands of workers are dying from hazardous exposures aggravated by climate change. Extreme weather events are increasing, exposing workers to wildfires, flooding, and major industrial accidents. The financial implications cannot be ignored due to lost productivity, business disruptions, and damaged infrastructure. The moment is now to ensure safe and healthy work in a changing climate.
Thank you all for joining us for this incredibly important webinar on the impacts of climate change and heat stress on occupational health and safety. And you can just see how important it is from that really powerful introductory video. Nibosh are delighted to be joining forces with our friends from the ILO. And I'm delighted to be joined by Dr. Manal Azzi, who will be introducing herself shortly, Dr. Andreas Flores, and Dr. Halshka Grasic. Very shortly, we'll be moving on to the really innovative and creative presentations. But just a reminder before we get into that, please submit your questions in the Q&A box that you will find. We've got so much to discuss, but we will try and get to as many questions as we can. There's also an attendee chat where you can ask and answer each other's questions as well. And there will be resources and links available at the end of this webinar. Now, without further ado, I'm going to ask our friends from the ILO to introduce themselves. Dr. Manal, can we start with you, please?
Thank you so much, Dee. It's such a pleasure to join you and all our NEBUSH friends and network on this occasion. I'm Manal Azzi. I'm the team lead for occupational safety and health at the International Labour Organization based in Geneva. And I'm joined by my colleague, Halshka.
Hello, thank you very much. Pleasure to be here with all of you talking about such an important topic. My name is Halshka Grasic. I'm a technical specialist on occupational safety and health at the ILO in Geneva.
And I am Andreas Flores. I'm a professor of physiology at the University of Thessaly in Greece and a visiting professor of environmental medicine at the University of Ottawa in Canada.
Thank you all so much. We're incredibly grateful to have your expertise with us. Dr. Manal, I'll hand over to you. Thank you again.
Thank you. I think what's really important to highlight, and we're really happy that we can do this in the context of the World Day for Safety and Health at Work that happens every April, 28th April. Just yesterday, we've seen so much coverage on the issue of climate change and heat and so much global interest in the lead up to the World Day. So we're quite happy that we took the time to do some research. We have two reports coming up. The report that was launched last week on climate change and safety and health, but also one more specific on heat stress that we will be launching in a couple of months as well to complement the global report. What we've seen is there are alarming numbers globally of how the issue of climate change is impacting the safety and health of workers globally. And what we're talking about is not just the changing temperature and excessive heat in itself, but also increases in exposure to UV radiation, solar UV radiation, and the resulting deaths and millions of diseases that people are facing due to that exposure. You've also, nevertheless, all probably experienced some form of extreme weather event around you or in your region, your country, from wildfires to hurricanes to flooding that have their own impact on the way the safety and health of our working environments. But also air pollution comes to also overlap with all of these other hazards and continues to be a key hazard for workers. Indoor and outdoor kind of pollution and air quality comes to exacerbate some of the hazards that we're seeing with the change in climate today. And some other issues we'll be discussing, of course, are the increase in certain insects and vector-borne diseases due to the changing temperatures that we're facing, and in particular sectors and regions where workers are highly exposed. Not to mention the increase in pesticide use and the different effects that chemicals that we are exposed to are having on our bodies when we are exercising effort and work in certain conditions. So it was really important for our global report on climate change and safety and health to be able to cover all of these issues. And obviously not just heat, that is the first thing that comes to mind, although the most important one, and we'll be hearing a little bit more about that from Professor Flores. But before we go there, I really wanted to share with you some of the big numbers that we've seen come out of the report. We have over 2.41 billion workers exposed to excessive heat at work every year. We're also looking at over 22 million workers suffering occupational injuries because of this excessive heat, and some 19,000 deaths. And these are alarming numbers because what we're talking about concerns more than 70% of the workforce. So it is a workplace issue. It is a worker health issue. We're seeing heat exhaustion, heat stroke, different kinds of kidney disease, cardiovascular disease, and many other health threats to our workers. So we do need to do something about that. Maybe I hand over to my colleague, Dr. Flores, to discuss more what we mean when we say heat exposure, excessive heat, heat stress, and what kind of interesting research he's been doing with his team in Greece. Dr. Flores, over to you.
Thank you, Manal. So heat stress is the excess heat that our body absorbs when we are working in a hot environment, and it can happen because of any of the following three factors acting either alone or in combination. So the first factor, and the most typical one, the one that most of us are familiar with, is being exposed to heat from the environment, whether it is because of high temperature or humidity, or working under the sun, or working in a very low wind. But there are two other factors that often we forget. The first one is the added heat that we absorb due to wearing protective clothing, and also the heat that's being produced in our body when we are doing intense work. So it's important to consider all these factors when we are either trying to protect ourselves, trying to protect our fellow workers, but also when we are designing strategies at the level of the organization or even at the national level to protect workers from heat stress. Now, some of the things that we need to take into account, since I was just referring to what we can do, is we certainly need to consider the amount of time that workers are exposed to heat. So trying to, first of all, quantify the level of heat stress, and then trying to devise ways to use the hierarchy of controls that ILO so amazingly has put out there for several years now, to use the hierarchy of controls to minimize the exposure, substitute it if possible, and overall, save workers from this very important physical hazard. These, for example, some examples for this include hydration strategies. So use white water, first of all, accessible water. Often we see in workplaces, workers don't have readily accessible water to them. They have to walk for a long time to go and get water, or often the water is not potable or it's not cold enough. So we've seen that water is very practical, economically viable, probably the best, I would say overall, the best strategy that we can use to protect workers' health. And it addresses a very important hazard, a very important health outcome, that comes from heat exposure, which is chronic kidney disease. We're still, in the science world, we're still not sure whether chronic kidney disease comes just because of heat exposure, or whether heat exposure exacerbates, so increases the risk for getting to chronic kidney disease. But certainly it is part of the puzzle. So it is important to hydrate enough when we're working in a hot environment to reduce the level of risk for the workers. So hydration is really important. Another very important strategy is to take frequent breaks. And the first thing to think about when we're talking about this is, first of all, take breaks when somebody feels the need to do so. It's important to self-pace, self-regulate the work, and then also take organized breaks. All the workers should be taking enough breaks. For example, in some industries we use and we recommend 10 minutes every hour. Again, it depends on the level of heat, but there should be some structured breaks when the workers should be resting in a cool, shaded environment and hydrate during that time. So these two would be, I guess, the ones that come to mind first. But also we often use other ways to minimize heat stress, including, for example, improving the clothing that the workers are wearing, either if they're wearing a normal work uniform, or to try to enhance the personal protective equipment that they're wearing to try to minimize the heat burden of that PPE. And at the same time, another strategy that we often use and it's shown very good results is to try to substitute some of the very intense physical tasks with machinery when this is possible. And here we're just talking about like tasks like lifting, especially when we're doing it in an outdoor environment. And the workers have to lift very heavy loads up stairs sometimes, and they're under the sun in the scorching heat.
Thanks, Andres. I think that was very helpful to actually break down the issue and understand what can be done, something useful, and what heat is and how it is affecting workers. But climate change, of course, is a bit broader than heat stress. Maybe we can hear from Dr. Graysick about some of the other hazards that workers are facing in workplaces.
Yes, thank you very much, Manal. Certainly, you mentioned at the beginning of the presentation that a majority of the world's workforce is exposed to some of these climate hazards, 70%. And so the question we need to ask ourselves is, what is a typical exposure scenario? What does it look like for workers around the world? And it's very clear to us that workers do not work in a bubble. They are not exposed to only one of these hazards. The reality for many of the world's workers is that they are exposed to multifactorial exposure scenarios. So they're exposed to heat, but also UV radiation, air pollution, increased vectors, and are suffering from vector-borne diseases, maybe spraying agrochemicals. And their communities may also be impacted by these extreme weather events. So what the report has showed us and what it's revealing is that in addition to the billions of workers that are exposed to excessive heat, billions are also exposed to solar UV radiation and air pollution, something around 1.6 billion at risk of exposure. So these are outdoor workers that can be exposed to really this cocktail of hazards. We know that from air pollution, we have almost 1 million work-related deaths from air pollution alone. When we take into consideration then the broader picture, things like the agricultural sector, in an informal setting, we have a huge risk of exposure to agrochemicals. Now, what the fear is that there's an increased reliance on agrochemicals because of things like extreme weather, droughts, increased pests due to changing temperatures. And so here we're seeing that there may be 900 million workers at risk of exposure. And these can lead to things like pesticide poisonings, cancers, neurodegenerative effects. And so the scope is really broad. And I think here we need to highlight the point, what I mentioned already, this idea of the cocktail of hazards. What is the real risk for these workers that are being exposed? It is not just one health outcome. So there is a burden of hazards. There are overlapping hazards, and they may also be very synergistic. I'll give you a quick example. If we're looking at rising temperatures and things like drought and the need to use more agrochemicals, for example, we know that workers need to be wearing protective clothing that is protecting them from the toxic chemical exposures. When they're wearing this kind of heavy PPE that's not breathable, there's an increased risk of heat stress, as Dr. Flores just mentioned. And so we're seeing that these risks are influencing each other and they are exacerbating each other. These cumulative effects may pose an unprecedented risk for the world's workers. And this is where we stand right now. And this is where we really need to make some kind of effort, a global effort, to make sure that we are adapting what we're doing at the workplace level to all of these different types of risks, and making sure we're understanding what works the best for different sectors and different working populations. I'll hand it back over to you, Manal. Maybe if we look at some of the responses now.
Thanks so much, Halshka. That's, very informative. It's, necessary to understand the overlap and the multidimensional effect, but also that response that we need when we're tackling this issue. And one important point that comes out clearly in the report is that we're not starting from scratch. Obviously, we already have international standards that protect workers' health. The idea is that we need to just be aware that these hazards are now increasing. In some places, they're emerging. They weren't there before. In some sectors, they're evolving. So the exposures are changing, and the mix of exposures is changing. And we have more knowledge on the impact and more foresight to what's coming. So the ILO, of course, Safety and Health has over 19 conventions already to manage and control all hazards in the workplace, be they environmental, chemical, biological, ergonomic, psychosocial. So all the hazards and exposures that have just been mentioned, we do have some key international documents. Like for climate-related hazards, we have at least 10 ILO conventions on general control measures that apply. It's on reduction of hours of work, on hygiene, on recognizing diseases that result from these hazards as diseases that we can compensate as occupational in nature. All of these are well regulated in our international recommendations. For excessive heat and also for ultraviolet radiation, we do have a code of practice on ambient factors in the workplace. I encourage everyone to also have a look, browse through it. We have a plantations convention also that does talk about heat. For air pollution, we have a working environment that covers air pollution, noise, and vibration convention of the ILO. And of course, for extreme weather events and mainly for major industrial accidents and prevention of major industrial accidents, we do have very specific conventions on that, including employment and decent work during emergency situations. And some of the discussions we've had lately have shown that there's a huge link between emergency preparedness, especially when it comes to extreme weather events, and integration of occupational safety and health elements into these emergency preparedness is necessary, especially when it is part of these extreme weather events and the impact it has throughout the direct impact, but also all the frontline service workers, firefighters, and many others that are exposed to different combinations of chemicals, but also physical hazards as they go about their work. We also have like workers' housing and accommodation recommendation at the ILO that can really that targets a little bit some of the contagious and infectious diseases that could be faced through vector-borne diseases. And also recently, a year ago, we adopted technical guidelines on biological hazards, and we are in the process of developing a new and updated standard, an instrument on biological hazard management. So that also will include issues related to infectious diseases transmitted or increased due to changes in climate. And obviously, very well known to many people are some of our agricultural standards and our chemical standards, 170 and others, that target and manage and propose control measures to eliminate, substitute, decrease exposure, and protect workers from such exposures. That's at the global level. But there are many national policy responses and workplace level responses. I'd be curious to hear a bit more about them from Halshka and eventually from Dr. Flores, focused on heat stress policy responses, in addition to what they've said already. Halshka?
Yeah, thank you very much, Manal. I would be amiss, however, if we didn't mention one specific health impact that I think we need to reference here, because this is a global webinar. What you see on the screen is the impact from different hazards, but we also need to talk about mental health. There is a huge impact on mental health due to these exposures, and we need to mention that, from things due to crop loss of productivity, closing workplaces, for example, because of heat and losing a day's wage, or simply from direct impacts from heat, things like behavioral changes or sleeping pattern changes. And so I had to mention that before we go forward. I think we have to say that. Now, when it comes to the global policy responses, moving back to that, thank you, Manal, for the overview of the ILO standards. They're critically important. Again, we're not starting from zero. At the national level, many countries around the world have taken some of these key messages and adapted them to their national legislations. Some of the things that we're seeing, for example, on heat stress, the setting of maximum temperature limits, stopping work at the hottest part of the day. This has been done now in many countries. It's being replicated, being used as a good practice. Maybe Dr. Flores can elaborate a little bit on that in a second. But we're also seeing that many countries do have the specific OSH legislation when it comes to the underlying hazards of many of the climate-related risks. So we see countries that have decrees on reducing UV radiation and making sure that there are considerations for how many hours workers are being exposed to sun. In Chile, for example, there's a Ministry of Health decree about this. We're also seeing new official standards come up about the surveillance for things like vector-borne diseases in the workplace, knowing that there's a spread of many vectors to new places. Europe, for example, is seeing for the first time spread in the south, malaria, dengue, various kinds of zoonotic diseases that were not present before. And so there is now an increased surveillance for workers for these kinds of diseases. A very interesting link that we're seeing too is that link that I mentioned before about spraying pesticides in the hottest part of the day. In Costa Rica, there is a new decree about the application of pesticides and it being prohibited at the hottest part of the day to make sure that there aren't these kind of concomitant exposures. So that's very interesting. So we're seeing also a movement towards the recognition of occupational diseases as climate related. And this is a very important tool. Occupational disease lists that take into consideration things like heat-related illnesses, things like the spread of different types of vector-borne diseases like Lyme disease, malaria, and dengue as being specifically related to the workplace environments. And so we're moving in a good direction. There are good practices from different countries. We do need to do more, however. We do need to make sure that what is in the OSH legislation is specifically related to the risks at the national level and for the sectors, because this is where we're seeing a bit of a breakdown, that there might be general precautions, but there isn't a targeted view to protecting vulnerable groups of workers or sectors that are the most impacted by climate-related risks. Maybe I'll hand it over to Dr. Flores to elaborate a little bit on the heat-related national legislation, because this is really a fascinating part of the story and something that many countries are rapidly trying to implement, given the impending hot season, at least in the Northern Hemisphere.
Absolutely, thank you. I think your comments were spot on. One important issue to remember is that our analysis is showing that about 1 in 10, so out of the people who are affected by heat, or the person days, as we call them, affected by heat, only 1 out of 10 is during a heat wave. And we all know that typically countries, ministries of labor, produce these warnings and work stoppages during heat waves. This means that 9 out of 10 times where workers are exposed to heat, there's no warning as such. And this means that we need to create an integrated framework where workers are protected all the time and not only during heat waves. As you said correctly, a lot of countries are moving that way. And 10 years ago, these countries were less than, to my knowledge at least, they were less than 5. Now we have, in our report, we will describe at least 20 that have moved towards that direction. And anecdotally, I can tell you that more and more countries are moving that way as well. As you mentioned as well, typically these legislations include provisions for acclimatization, helping workers to get used to heat and provide additional support, especially early in the warming season where workers are not acclimatized, which means that they're a lot more vulnerable to heat compared to later on in the hot season. They also include provisions for education, training, and first aid, how to recognize symptoms for heat stress, heat stroke, and education about many other health outcomes related to heat, because it's not only the heat stroke, which is, of course, I would say the most serious health outcome, but there's also issues related to dermatological problems, central nervous system problems like fainting or slippage, or, for example, not being able to work as much. And also there's a lot of issues related to hydration and water balance in our body, overhydration or underhydration, and how much water they should be drinking. So there is a lot of legislation does include some mentioning at least, or sometimes very detailed guidance on that. There's also a lot of these legislations include provisions for risk assessment, of course, and as you said, thresholds for either temperature or a more integrated index, such as the wet bulb load temperature or the heat index or the UTCI, as is well known, or other indicators. Most of the time is the wet bulb load temperature, which seems to be the most popular heat index used, but countries sometimes choose others as well. So it's important to realize that there's a momentum towards that, and we're hoping to see more and more countries moving that way and protecting workers, because, as I mentioned before, the vast majority of the time, 9 out of 10 times, workers are exposed to heat not during a heat wave. So it's really important to protect them throughout the year, and in all different sectors where sometimes they're exposed to heat not from the environment, but because they're wearing either very insulated clothing or because they're doing a work that is very, very intense. So there's a lot of heat produced internally. So this has nothing to do with the environment, really. Therefore, looking at the meteo service and seeing whether we can use that as a guide is not always the best way to go to protect workers fully.
Thank you, Andreas. Dee, I think we've discussed some of the key issues related to exposure, impact, and some policy responses.
Thank you. Yeah, really, really amazing. Some of the other points that I think people are asking questions on and are interested in is a little bit more about the indirect effects of heat stress. Increased chance of injury because of the heat stress. Could somebody perhaps tell us a little bit more about that?
Sure, maybe Andreas
would like to start. Andreas, thank you.
Yeah, so we see that indeed the risk of injury is increasing tremendously. We've seen, as we mentioned earlier, we see 22 million occupational non-fatal injuries happening every year due to heat stress. This because of the rising exposures because of climate change. This will increase, and we've seen a rapid increase compared to 20 years ago. So we've seen that the numbers of workers and the numbers of non-fatal injuries are rising steadily with climate change. And as we all know, a few weeks ago, there was a number of reports published showing that to 2023 was the hottest year on record, same as the year before. So every year we break records, and more climatologists are starting to realize that we need to readapt climate rules, because we're actually maybe seeing things more optimistically than we previously thought. Which means, of course, if we translate that to the workplace, which means that more and more workers, and actually to rising rates that we hadn't thought of before, be exposed to heat stress and to, of course, fatal but also non-fatal injuries.
Thank you. Dr. Halsco, have you anything to add to that?
I think that Dr. Flores, covered it very well. In addition to 2023 being the hottest year, we're seeing this trend that every month tends to be now the hottest month on record. Just a few days ago, we saw that March 2024, I believe, was the 10th month on continually on as the hottest month. So we are seeing this trend, and I think this is why there is this urgency as well to act. We're seeing the deaths, the injuries, and now we're just a few months away in the Northern Hemisphere from being in very hot temperatures again. And so that is what we're feeling in general at the publication date of this report. Given these staggering figures, what can be done now? And what do we need to continue to leverage to make sure that at all of these levels that we mentioned, at the international, global, but also workplace level, that there are the preventative measures in place to make sure we're saving lives, because that's what we're talking about here. We're talking about saving lives on a day-to-day basis, while at the same time trying to implement mitigation measures in a broader view of society. And so there's really this feeling now of how do we make sure that we're making a change now for the global workforce.
So important. One topic of conversation and discussion that often comes up at our webinars, because our audience will largely be made up of health and safety professionals and practitioners, is who owns issues like this, and are people doing enough? So that is a huge typical health and safety professional now has the core health and safety to deal with. They have psychosocial risks, they have the environment, but there's a desperate need for dots to be joined and everybody to come together. So what would your advice be to the typical health and safety professional? Like you say, it's so urgent that we make a change, but what can health and safety professionals do to contribute to that change?
Yeah, thanks so much for that question, Dee. I think our problem in occupational safety and health is we shy away sometimes from these globally pressing issues, and we shouldn't be shy. This is core into our mandate as the Occupational Safety and Health Committee. We are protecting and preventing hazards for people who are most at risk globally. It's because of the exposures that workers face that we do have numbers. These are people facing certain hazards and risks on many hours daily, over several weeks, over years. And thanks to these workers, we're able to gather global data that can allow us to estimate the burden of some of these diseases, the burden of the toll on deaths and numbers. And so our role, and in everything we've been given in this discipline of occupational safety and health, from knowledge on medical surveillance, health surveillance, monitoring of our workplaces, steps in controlling measures in the face of risks and hazards, administrative controls, but also, before this issue of climate change coming to make things worse for some of these hazards, we're already expanding the area of occupational safety and health. We can no longer see workplaces as isolated from the bigger community. We're talking about pandemics, infectious diseases, changing environments, changing work patterns, changing workforces, ages, demographics. All of that is having an impact on the discipline of occupational safety and health and giving occupational safety and health a bigger role. So we need to stay educated. We need to be open to learn different skills, which we may have not. We need to be open to collaborate with departments, ministries, national planners, municipalities, and various stakeholders that we weren't used to. And this should not be seen as trespassing beyond our division of roles. It should be seen as we are all now facing no lines. There are no lines between jobs, between homes. So we are facing threats at a multifaceted threats that need to be addressed in a multifaceted way. There is no option. And one thing that the world of work can do, and I think we've noticed in some of our research, is that workers themselves, their unions, in addition to employers and their organizations and people who want businesses to thrive and to increase productivity, they're working together. The collective bargaining discussions that have happened to actually voice the problems that people are facing on factory production lines, in agricultural fields, on construction sites, everywhere. The workers need to tell us, and as Professor Flores mentioned earlier, the worker needs to listen to their needs as well and self-pace. They have a huge role to inform us of where they're at, and they have the right to self-pace. And this is where the international protection comes in, where today safety and health is a fundamental principle and right at work, where if you feel you are facing certain danger, you are allowed to voice and protect yourself without facing retaliation. And I think these are the various layers of international protection, national level guidance and training, education, mainstreaming in broader policy areas come in. But maybe my colleagues have something to add on this particular point.
Please. Yeah. And huge congratulations, by the way, on that right to the workers, just phenomenal. And like already you can see the dots joined, creating that psychologically safe place and the psychosocial safe place for people to speak up. But yeah, please, if our colleagues have got additional comments on that.
Yeah. I think Manal highlighted a very important issue that we, the OSH professionals, need to be in the driver's seat for change when it comes to this issue. And likewise, I think there also needs to be a better understanding for broader society, for consumers, for participants in civil society to understand also the unique OSH risks that workers face. When we're looking at the bigger pictures of mitigation, we're moving towards green and sustainable economies. We're moving very quickly in this way. And what the report also shows is that sometimes these rapid shifts to technologies can have adverse effects for some of the workers along the supply chains. So when we think about, for example, the intense need for critical elements such as cobalt and the new challenges, the new OSH risks for workers along that supply chain, from the extraction phase to the dismantling phase at the end, we know that we have millions of tons of, for example, solar panel waste every year from greener economies. But who is facing the brunt of exposures to some of the heavy metals, the toxic materials during the recycling and during the waste picking areas around that? And so e-waste is a big issue. And so everything is connected. And that's what we're seeing, is that we're not working in a bubble. We are all connected, whether we're OSH professionals, whether we're public health professionals working on heat action plans, whether we're consumers and just part of society. We need to all be aware of where we stand, who's facing the risks, and realizing that we're all interconnected in this bigger picture of climate change and the risks for health.
Absolutely. Truly stronger together. Truly stronger together. Dr. Andreas, anything you want to add on to that discussion point?
Absolutely. I fully agree with what was said recently. We're seeing, as I mentioned before, more and more that climate change is a much more broad threat. It affects, it creates a lot of dominoes effects and really impacting nearly every aspect of a worker's life. And as a result, in my view, climate change is the biggest threat to occupational health and safety for the next at least 20 years. We're seeing we are already have entered in an uncharted territory. Scientists, we're scrambling to reanalyze and remodify our models because it seems we're too optimistic about things. And what was previously considered the worst case scenario is probably an optimistic target or an optimistic assessment of things. So workers are certainly, in my view, probably the most vulnerable population that will be affected by climate change. Because, I've been supporting other agendas on climate change and protecting public health, for example. And in public health, you can use measures. You have an array of measures that you can use. For example, cooling shelters everywhere, or asking people to stay home. Well, workers are not able to do that, and they're exposed to so many hazards as well, and they have a very limited array of interventions and protection measures, and that's why, in my view, they are by far the top, the most vulnerable population group, and that's why climate change is certainly the biggest threat to occupational health and safety in the next years, and we need to push this agenda and invest on policies to protect workers from it.
Thank you, and thank you all for your amazing work you're doing in bringing this to the attention of the world. So we've spoken about the importance of workers having the all-important voice, about the importance of the practitioners and the professionals driving this forward. We are drawing near to the end of our time, but what would your message be to the leaders in organisations around the world? Manal, would you like to start us on that one? I know we could probably need another 40 minutes at least to address that.
Yes, but... I mean, because I sit somewhere in the middle. I consider myself representing leadership in these areas. We sit in a very lucky space in an international organization that has an influence, that has a platform globally to voice these issues. And I think by doing so through the context of World Day awareness raising events, that's already a good job. What we need to be also, I think the numbers, the effects, and the cost talks. Advocacy for these issues, we need to present the data, working with the scientific community to translate some of these findings into policy and action is key. And this is what decision makers at the national level across ministries and governments and budget owners need to understand, that it costs more most of the time to do nothing in prevention of some of these increasing hazards than to actually come and look at the workforce we've lost, the productivity we've lost, and the health and cost of health and sickness and deaths of many people in our communities. So I think advocacy needs to be based on evidence, and that talks for itself to prevent the impact that we are already seeing.
Thank you. We are drawing near to the end of our time. Dr. Andreas, any final points and issues you want to raise before we close?
Sure. I will just follow up on what Manal just mentioned. I would say that right now, the last 5 years, 70% of the literature, the scientific literature on occupational heat stress has been published in the last 5 years. Our knowledge is very, very updated because the topic has been researched extremely in the last 5 years. We now know much, much more compared to a few years ago. We have the evidence, as Dr. Azi just mentioned, and we now need to put them into practice. There are very practical, economically viable interventions we can take, simple, that will not affect normal working conditions. And so it's a win-win both for the workers and their health, but also for the employers and the workers as well, because no one wins, when productivity drops. Both the employers and the workers are losing when productivity drops, and both workers and the employers are losing when health standards are dropping. So it's really important to use these data, take up all the information provided by the portion of this topic, and implement it in the workplace, both at the workplace level, but also at the national.
Thank you so much. And Dr. Haska, any final thoughts from you?
Yeah, thank you very much. A little bit on what was already said, but this idea of having very strong evidence-based research to implement the preventative measures, but not waiting too long for those research projects to take place, because we know what works now. And we know that we are moving towards a hot temperature season, and we need to implement them now. So that idea of moving quickly, moving rapidly, trying to leverage what we already have to make sure that lives can be saved, and that we don't have very sad headlines as we did in the last summer season about workers dying at the workplace, because this is something that can be prevented, and we know that, and we need to implement these measures. I think it's clear from this discussion that workers and workplaces really must be at the heart of this climate action, and that when we bring in public health professionals, when we're looking at heat action plans, for example, which are gaining a lot of popularity in many places, the worker must be considered, the workplace must be considered. And we have already the model at the ILO for working together, for working with governments, with employers, with workers, to making sure that all voices are heard, that everybody's at the table. This is a question of health. This is a question of safety. It's a question of productivity. It's a question of socioeconomics. It's a question essentially of social justice. And that's where we are today. And so having all of these actors together is the key to efficient action. And the ILO can really be the organization that leads this effort. And we're really looking forward to doing that in the coming months, in the coming years. Thank you.
Thank you. And finally to you, Dr. Manal, any final thoughts from you?
Oh, sorry, I thought I already did my final thoughts.
I was just giving you one more chance.
Thank you so much, and I mean, I'm so happy to hear the input from Dr. Flores and Dr. Grasic, and I think it only gives. I hope it gives some confidence to our listeners and to our leaders, because I don't look for other people to be leaders. I consider our community, the OSH community, a leader, and we are here because we hear from the ground what's going on and what's killing us and what's making us sick. So we are the right people to say how we can protect ourselves and how we can mainstream our concerns across policies and continue that conversation and continue the learning process. Our work doesn't stop once we've finished our studies 20 years ago, 10 years ago, 5 years ago. This is a science that continues to evolve. We make mistakes, we learn, we move forward. And I think this is what this community, the strength of this community is, to keep an open mind, work with others so that we can reach our goals.
Thank you all so much. On behalf of everybody that's joined us today, your passion, your commitment just shines out of all of you. So thank you for that. Thank you for being the voice of the worker. Thank you for producing the facts, but not just the facts and the research, actually producing accessible tools to give people to make that difference. You're all amazing. Your time is precious, and we thank you for it. Thank you again for joining us.
Thank you so much for this opportunity.
Thank you very much.
Thank you, Dee. Really a pleasure. And thank you to everyone that joined.
2023 was the warmest year on record. Climate change is changing everything. It is causing deaths, injuries, and diseases for workers everywhere. Climate change is leading to excessive heat, extreme weather, UV radiation, air pollution, and an alarming increase in certain diseases. These are just some of the dangers that are threatening the health and safety of workers and putting their jobs at risk. 2.4 billion workers are exposed to excessive heat at work every single year. And the total number has gone up over 35% over the last 2 decades. Our most recent data shows that over 26.2 million people are living with chronic kidney disease related to workplace heat stress. Excessive heat kills around 19,000 workers and injures around 23 million workers every year. UV radiation is impacting even more workers, around 1.6 billion, and killing 19,000 per year due to skin cancer. In addition, these 1.6 billion outdoor workers may be exposed to air pollution too, resulting in some 860,000 work-related deaths. Outdoor workers are also vulnerable to vector-borne diseases, which kill around 15,000 workers every year. Climate change is leading to an increase in the use of agrochemicals, putting the over 900 million agricultural workers worldwide at risk of exposure. Every year, 300,000 die of pesticide poisoning. Each of these climate-related hazards represents a threat in and within itself, but they are also uniquely interlinked and may result in a cocktail of hazards. The cumulative effect may pose an unprecedented threat to humanity, and we do not have the full picture of the real impact yet. This highlights the multidimensional challenge that lies before us. Climate change is a health issue. It is a workplace issue. It is also a social justice issue. But above all, it is a human rights issue. It needs to top the list of our global priorities. Going forward, workers and workplaces must be at the center of climate change action. Heat action plans must prioritize workers' safety and health. And legislation on occupational safety and health needs to mainstream climate change hazards as a matter of urgency. We are in a sprint to save lives, and the time to act is now.